I'm Dr. Steph Roche, and today I'm going to be talking about menopausal hormone therapy, specifically looking at the risks, because this is something really controversial that comes up a lot. So where did this misinformation come from? More than a decade ago, a huge study was done, the Women's Health Initiative study. And what they did is they gave a whole lot of women hormones at different ages and stages of menopause. And what they concluded is that menopausal hormone therapy is not safe. What we know now with expert opinion and a lot of analysis of the data is that you really can't make a blanket statement about that. And there are so many nuances. And most importantly, there is a golden window. So if you start menopausal hormone therapy within 10 years of your last period and below the age of 60, the benefits generally outweigh the risk. So specifically looking at heart disease, let's talk about that first. So your risk of heart disease is increased if you start menopausal hormone therapy after the age of 60 or more than 10 years from your last period. If you have already gone out of this window, so let's say you're 68 years old and you're still having hot flushes and you start menopausal hormone therapy then, you're putting hormone on arteries or blood vessels that are already diseased, and you do have an increased risk of heart attack, etc. So we generally don't recommend hormone therapy for those women. If you are within 10 years of your menopause and you're younger than 60, the overall finding is that when you're on menopausal hormone therapy started within that time, you have a lower risk of cardiovascular disease. So there is a golden window. If started within those 10 years, below the age of 60, you have a reduced cardiovascular risk. So that's one important finding that we've now separated out over the years. Number two, cancer. So this is a huge worry for many people. Luckily, with cancer, we have much better outcomes now. So there's an incredible and great, really increased survival rates among breast cancer survivors now. But it's still scary to know that you might be on a medication that increases your chance of breast cancer. So firstly, it really depends on the type. It's not a blanket rule. If you are on estrogen-only hormone therapy, so if you've had a hysterectomy, you're only on the estrogen, your risk of breast cancer is actually reduced, which sounds counterintuitive, but our hormones are really complex. And we found that women on estrogen only actually have a reduced risk of breast cancer. There is an increased risk of breast cancer, though, when you use combined hormone therapy. So that's a type of estrogen plus a type of progesterone. So if you use a combination, that's where we see the increased risk of breast cancer. But over time, we've developed much better forms of hormone therapy, and this is where it gets a bit tricky. So now the hormone therapy that we recommend first to women struggling with hot flushes, night sweats, or osteoporosis is a combination of a transdermal, so through the skin type of estrogen, so a patch or gel, plus something called micronized progesterone. So if you're taking that type of estrogen plus that type of progesterone, both of those hormones are actually body identical. So they're identical to your natural hormones. And in women on that combination, which is the gold standard, which your doctor should offer you as your first option, you will not have an increased risk of breast cancer for 5 years of use, and probably longer, but we're still waiting on that data. The risk of breast cancer comes in when you're using older forms of hormone therapy. So if you are on the old combination tablets, just chat to your doctor about what exactly is in your hormones, because we know that it is true that the older forms of hormone therapy, combined hormone therapy, do increase your chance of breast cancer. The newer forms are body identical, the transdermal estrogen plus micronized progesterone, and they are not associated with an increased risk of breast cancer for up to 5 years of use. Then lastly, to put it into perspective, even though on combined hormone therapy, you might have an increased risk of breast cancer, there are other things that play a much more important role. So let's say, for example, in the UK, they have 23 per 1,000 women. They have 23 cases of breast cancer per 1,000 women, age 50 to 59. If you're on combined hormone therapy, or if you are on the pill, so you're taking in estrogen and progesterone as a contraceptive pill, there will be 4 additional cases of breast cancer per 1,000 women. So there is a slight increase, 4 per 1,000. But if you drink more than 2 units of alcohol per day, there are an additional 5 cases of breast cancer per 1,000 women. So that's already more significant than any of the hormones we can prescribe you. And lastly, if you are overweight or obese, there are an additional 24 cases of breast cancer per 1,000 women, just from that. So if you're worried about breast cancer, what you really need to be focusing on is lifestyle and diet. And we will have videos coming up from our dietitian. What we want to emphasize is that for all women, if you want to reduce your risk of heart disease, cancer, and live longer, your biggest concern shouldn't be whether or not you're on hormone therapy, although that's an important discussion to have with your doctor. Your biggest concern should be your lifestyle. We want you to lead a full, active, healthy lifestyle. That's the most important way to reduce your risk of all of these complications. So look out for our next video. We will go through that in more detail, and let us know if you have any questions.